Hi, my name is Felice Gebhardt and I'm a licensed physical therapist, and I'm here today to talk to you about wrist pain. There's a few reasons you might be having wrist pain, and we want to make sure that you know what can cause it so you can avoid it, work on prevention, maintenance, and treatment. Because we're not performing an examination of you today, I want you to know that if your pain is severe or persistent, you should definitely follow up with your primary care physician. So, two common types of wrist pain that you can have with the types of injuries that you might incur in training would be a tendonitis for ulnar-sided wrist pain, or an injury to the triangular fibrocartilage complex right here. So we're talking about ulnar-sided wrist pain today, which is the pinky side of the wrist. So the most important thing to be conscious of is your form as you're training. This is the most common cause of injury because it's likely a repetitive strain injury, and repetitive strain in incorrect form can cause injury. So you want to be cautious that you're not doing excessive extension and also deviation this way. So sometimes that you might find you're feeling pain and also finding yourself in those motions. If you're not using proper form with pad holding, you may be getting hit more on the fingers or on the lateral part of your hand, causing that excessive extension as well as the rotation. So you want to be sure that you're holding in what they call a Vulcan grip, and that you're absorbing more forces through the palm with a little pocket of air in here and slightly forward flex in your wrist. The cartilage injury can occur in a similar way, just by repetitive strain, because it's also part of this joint in your wrist, but it can also be an overuse injury. It can be caused by a fall on an outstretched arm, or it can be caused by excessive rotation, which would be this way or this way, which also occurs with punching, bag work, pad work, or in a fight. So for the cartilage, it's really important to rest if that's injured, as well as rest with the tendon, but this one might require special bracing. So it's important to get the right diagnosis for the triangular fibrocartilage of the wrist. So besides rest and possible immobilization, if you're training, you want to probably take up to 2 weeks off of high impact through the wrist. I would recommend avoiding bag work, pad work, or anything that involves a high impact load or compression through your wrist. So that means you could do some shadow boxing, you could work your legs, you could do drills that just don't involve impact through your wrist or your hand. Other things that can help treat your wrist pain might be icing, because there's likely inflammation that's occurring through the tendon, or because of swelling throughout the cartilaginous area right here in your wrist. So you can apply an ice pack multiple times a day if you'd like, for about 15 minutes. Make sure that you don't apply the ice directly, because you can blister, and there's also some superficial nerves in the area that can be injured if they're exposed to anything that's too cold. I highly recommend throwing it in a pillowcase and wrapping that around your wrist after training, not before. I also think that it can be beneficial for you to work on range of motion and strengthening throughout the wrist, the forearm, and higher up the kinetic chain throughout the shoulder girdle to work on stability. So for the wrist, a few exercises that can help with stretching and range of motion would be stretching all the muscles on both the front and the back of the forearm, because these are the muscles where the tendons cross the wrist and help us with our movement. So these types of stretches include putting the wrist into that position, using your other hand to assist, and pulling back until you feel a good stretch in the muscles. You do not want to feel sharp pain with this. If you do, then back off a little bit, and if you don't feel a stretch, then you might not be ready for this yet. You want to hold a stretch for about 30 seconds, then relax, rest, and repeat. You can do that about 3 times a day. Then you can do the opposite. The wrist flexes down, use the hand on the back of the hand this time to pull in until you feel a good stretch up the back of the forearm there. Same thing, 30 seconds, 2 times, a couple times a day. So another wrist stretch that you can do if the other ones don't feel like they're doing too much for you, which were the flexion and extension for the forearm muscles would be a stretch where you can use the floor or the table and you're getting a little bit more of your body weight over it. So you're basically going to fully flex your wrist, and then you're going to place the back of your hand on a table, and then you're going to shift your weight forward, press down, and then slowly shift your weight back. So I'll demonstrate now. Back of the hand comes down, body weight shifts forward. Keep the back of the hand flat and your wrist down as you slowly come back until you feel a good strong pull through the forearm. Hold for 30 seconds. You can repeat that 2 to 3 times. For proper wrist and forearm strengthening, you want to have a firm surface to support the forearm. You want to be seated and have the surface not too high or too low so that your shoulders in a comfortable neutral position. I'm going to start with a light hand weight. This is a 2-pound dumbbell, and you can work up from there. You want to make sure that you have a good quality movement and aren't compensating if you're lifting too heavy. So you start with the wrist nice and neutral. For the extensors, we're going to slow and controlled, bring the wrist up and slowly down past neutral, back up. So you always want to go slow and controlled with these exercises. For strengthening, start with 3 sets of 10 each direction, and you can do that 1 to 2 times a day. You can turn over, work the flexors, slow and controlled. Same thing. A few other directions. Radial and ulnar deviation is up and down this way, thumb side, pinky side. Everything else stays nice and neutral. And then we're going to do rotation, supination, palm up. Hold the end of the weight, slowly rotate to palm down. If you have a cartilage injury, this will probably be painful. Don't do it. Don't force it. Just do what feels good. Muscle aching or burning is fine, but no sharp or intense pains. For strengthening higher up around the shoulder blade area, that can help also stabilize the wrist if there's any weakness in there, you can use a ball or you can lie on your stomach on the corner of a bed. Use some comfortable dumbbells, and you can do what's called I, Y, T, and W. So the I, you're going to squeeze your shoulder blades together as you lift your hands up. T's come straight out to the side. Okay. Y's, I'm going to drop that weight. This is a harder one, coming up overhead. And you can do a W. Three sets of 10 for each. Once a day is great. Another shoulder.
Hold on. And go.
Another strengthening exercise is the straightest punch. You want to have your shoulders flat on the ground. Then you reach your shoulders away from the ground, bringing your knuckles towards the ceiling, and straight back down. 3 sets of 10, once a day, with a comfortable weight. All of these exercises should be done with a neutral wrist, so you're not extended or flexed, but just nice and flat. So another way to do that serratus punch with some weight would be in this position, or you can take a full plank and do it. This is also a good way to work on the muscles with a neutral wrist push-up instead of doing a full extended wrist push-up to avoid wrist pain. Thanks for joining us today to review wrist injury and prevention as well as treatment. I hope that you got something out of today's video. Just remember that wrist pain should not be long-term. It might be acute, but if you're doing your rehabilitation a couple times a day for probably 2 weeks to start, you should feel significant changes. Make sure that you're icing, avoiding impact through the wrist For example, punching or any exercises where your wrist is in a fully extended or flexed position. Keep it nice and neutral. Make sure you're talking to your coach about your form and that your form is good and that you're not doing repetitive exercises incorrectly. If it does continue or persist, then make sure you follow up with your doctor to get the appropriate diagnostic testing done so that they can find the right course of treatment for you. Any wrist pain should not be long-term and keep you out of training for more than a couple weeks. If you have any further questions on this, or if there's any other videos that you'd like to request on taping or rehab, please leave a comment below in the comment box. Thank you for joining us.